Today, the first person diagnosed with Ebola in the United States became the first person to die here from the disease. Thomas Eric Duncan arrived in Texas from his native Liberia on September 20th. It's believed he contracted the disease earlier. He helped get a woman with the deadly virus to a hospital. Health officials say the 42-year-old was not symptomatic before arriving in Dallas, so there's little chance he infected anyone while traveling. Still, a Liberian man living here in Boston who was on the same flight as Duncan has been evaluated by doctors. That man is not coming forward for fear he will be stigmatized. My next guests say the Ebola outbreak has had a profound impact on the entire Liberian community in Boston. Jassy Senwa was born in Liberia and moved here 12 years ago. She's now the youth liaison for the Liberian Metro Boston community. And Melvin Don is also from Liberia. He's a pastor with Christ Pavilion Ministries and just returned from a trip to Liberia in August. Welcome to both of you.
Thank you.
Well, Reverend, the disease had already broken out when you visited in Liberia. Was there panic? Was there fear? I mean, what was the atmosphere?
I had entered Liberia like 2 weeks just before the Ebola broke out. At first, Liberians are people who normally don't easily believe stuff when it first starts, so it was like a fun. But after a while, when a lot of patients were reported dead, and it started being very serious. So there was a lot of fear and havoc. And one of the things that constitutes the society of Liberia is greetings with shaking of hands and hugging and all of that. And it was so saddening to see that Liberians, could not greet each other anymore with shaking of hands and hug. So it was a little bit too, devastating. Yeah.
Well, Jesse, we'd all heard just exactly what the Reverend said, that there was skepticism in Liberia, maybe even that it was a hoax. But I think we're past that point now. When you talk to people on the phone, friends and family, what are the circumstances? We look at the New York Times and other news outlets and we see people lying in the street. We see young children lying in hospitals unattended. I mean, is it that bad?
It is that bad. My grandmother is still there. My mother and my aunts are still there as well. And those are family members that I'm close with. It is like that in the street. When you look back and the wars that we've been through, our healthcare infrastructure is in shambles. So there are, people on the streets. There are not enough beds to hold people who have been tested or who are showing symptoms of Ebola and so forth. There are, barely any ambulances. Prior to the Ebola outbreak, we barely had anything. So now that we are faced with this epidemic, with this crisis, it has put us even way backwards than we were, during the times of war.
Is the country, either end of you can answer this, looking for greater assistance? I mean, of course, American doctors have gone there. We've seen that. But are they looking for emergency hospitals to be set up? What more can be done?
There are, and when you look at the aid, it was just actually on CNN earlier today, when you look at the aid that's been poured into Liberia and you compare that to other aid, like, when Haiti, when the incident happened in Haiti as well, you look at earthquake, you look at the typhoons and so forth, those aids that went into those countries, it was massive. Yeah. When you look at Ebola now and you compare that, it's not the same. They are looking for aid, funding, resources, and if doctors can go and help, that will be great. But when you look at Liberia, a country with only 4 million people,
4 million, yeah.
You look
at that today. I was shocked it was so small.
Right, and you look at Nigeria with like 178 million people.
Well, that's what I want to ask the Reverend about that. Why has it been contained in Nigeria? They have had at least one incident in Nigeria. Why is it contained? I mean, the borders are fluid in Africa. Why is it in certain places, Sierra Leone, Liberia? Why?
There are many reasons why I believe it is contained in other countries and it is not in Liberia. First of all, Liberia was just recovering from 15 years of civil war. And the country was just getting back on course from a long-lasting war, and the economy was, it entered to a place of growing. The economy was growing, but the reason I think it is having, more damages in Liberia is because, first of all, the health sector in Liberia is damaged. People are not well educated when it comes to, being, hygiene, minded or whatever. But I do believe that there are, like Jazzy just stated, more help, more education, more awareness, more funding, more facilities needs to be built that will, you know, increase the health sectors in Liberia.
I'm curious, have either of you felt stigma here by being Liberian? Are people wary or no? Or they don't even know you're Liberian?
Actually, Boston, really, in the Boston area, you highly see Liberians when it comes to how, like in Minnesota, a huge population of Liberians, in Rhode Island, a huge population of Liberians, in Philadelphia. So in Boston, where I live, unless I have to call Liberian, so it's not easily known, so nobody really knows we're Liberian and stuff like that.
Would you agree? But I mean, you work for an outfit that publicly announces itself as Liberian. So.
Right. And I have personally, you know, I have seen that in my life where you meet somebody and usually when they hear you speak for more than 10 seconds, then they hear the accent and they want to know, you know, where are you from? Me being proud to be from Liberia, I'm like, I'm Liberian. They go, oh. So we face that as well. I know family members have spoken to me as well that they faced the same stigmatization.
Well, that's certainly terrifying. All right, Jesse, Senwa, and Melvin Dunn, thank you so much for coming.
Thank you for having us.